Hello, everyone, and welcome to our Monday Minute. We are finally entering spring, even though it may not seem like that in some parts of the country. I want to share with you today the issues surrounding the end of the public health emergency for home health agencies. We will also do a session on hospice in the next Monday Minute. The end of the public health emergency is confirmed as being May 11th of 2023. And with that comes the end of many of the 1135 waivers. Back in February, I did a Monday Minute that specifically highlighted the fact that it had been announced the public health emergency would end and did a few highlights of what that means. But I need to give you some specifics today. We will also be releasing a blog toward the end of April, 1st of May, with some very detailed specifics surrounding the end of this public health emergency. For home health agencies, the 1135 waivers have been extremely helpful, but many of them will be coming to an end. Some of them have actually had congressional action and legislative changes to make them permanent. But the majority of them have not, and therefore they will be ending. So some of the ones that you definitely need to focus on preparing for their elimination include the OASIS completion. The comprehensive assessment is required to be completed within 5 days. That was lifted during the public health emergency, but as of May 11th, you will go back to being required to have it completed within 5 days. Also, the transmission of the OASIS documents to the database has not been required to be done within 30 days. We will go back to the requirement of it being completed, the transmission of the OASIS completed within 30 days once the public health emergency ends. Some other key aspects include telehealth, which I addressed in the Monday Minute in February. But the telehealth situation I did not fully address in the sense that the HIPAA regulation was relaxed during the public health emergency, which allowed agencies to use software systems such as Skype, etc., that were not found to be HIPAA compliant in the past, that were allowed to be used for telehealth during the public health emergency. That will end with the public health emergency in May. You will be allowed to utilize telehealth for face-to-face encounters through December 31st of 2024, but you will not be allowed to use software or technology that is not considered to be HIPAA compliant. So you need to make sure you are using compliant telehealth systems in order to conduct telehealth encounters, whether it is face-to-face encounters or actual telehealth services. The agency has the right to provide telehealth services with your clinicians, etc., permanently, but you need to make sure that you are using a HIPAA compliant format and that the telehealth services you are providing are a part of the patient's care plan. Face-to-face encounters will end as far as them being done via telehealth on December 31st of 2024. So we have yet some time to be allowed telehealth face-to-face encounters, but do keep in mind those encounters must be done via audio and video. They cannot be phone call only. In addition to this, the home health aid services waivers included the 12-hour required education for the home health aides relaxed during the public health emergency. When the public health emergency ends in May, you will be required to comply with the 12 hours of education beginning January 1st of 2024. The waiver includes that you will be allowed to basically not be in compliance with the 12-hour education through the end of the calendar year following the end of the public health emergency. So you will be required to be compliant with those 12 hours of education starting in 2024. In addition, the home health aid services requiring a skilled supervisory visit being completed every 2 weeks was relaxed during the public health emergency and will resume effective May 12th, so the day following the end of the public health emergency. Many of these waivers have been extremely important in home health agency survival during this public health emergency, with no one imagining that we would basically be 3 years in before we saw an end to it. Agencies need to start now in preparing for the end of that public health emergency, as all aspects of the waivers that will now be released and you will be required to comply with will be a situation that many agencies may find themselves in survey deficiencies, etc., if you do not get back into compliance with those. Thank you so much for joining us today. If Healthcare Provider Solutions can ever assist you in any way, please don't hesitate to reach out. Have a fabulous week and happy spring.